Until now, we've had mainly immigrant Americans, but down the road, we'll be adding various topics. And I wanted to start with Amanda. So let's get her on the phone, on the Skype. How are you?
Hi.
How are things in New Hampshire?
Oh, great.
Great. You look
Yeah.
fabulous. I haven't seen you in a
Thank
while.
you.
Your hair is
I
growing out.
know. I know.
Yeah, looks good.
Well, nothing else to do in a pandemic, but, work on self-care, I guess.
Well, before this program is over, you can sing for us since you're also a singer, right?
Oh,
Oh,
yeah,
yeah.
I am.
Okay. So I was saying this podcast I started a few weeks ago. We've had thus far mainly immigrant Americans, but
hmm
I always had the intention of adding different subjects.
Right.
And you are my first guest talking about
Yay.
women's health.
All right.
And first of all, I think this is very important for you to talk about your experience.
Yeah.
And it'll also be helpful to me as well as other listeners. So let me start with a little background and let me know if I get it correctly.
Sure.
Um, this I got involved with you with your second pregnancy.
hmm
You had delivered the first time in 2016,
17.
17 in California.
Yes.
You had a cesarean section. I think when I read the op note, the indication was that the fetal heart rate was not reassuring
Yes.
and just went straight to C-section without any labor. Is that correct?
Correct.
Okay.
Yes, it was during an NST, so it wasn't even planned. Like I didn't even go to the hospital. I just went to my regular 39-week checkup and they're like, "Oh, you got to have her today."
So let's step back a little bit. Your first pregnancy, why were you having a non-stress test? First of all, for those people who don't understand what non-stress test is, it's just like the term says, non-stress test. Being on a monitor for minimum of 20 minutes, and we're looking for a particular pattern that says baby's brain is being oxygenated well enough to be
hmm
reassuring. There are indications for high blood pressure, diabetes, maternal age, and whatnot. What was yours?
Um, borderline hypertension.
Borderline hypertension. Okay.
Yeah.
At 39
Um,
weeks.
I think that my OB at the time was a little too um, kind of like the fear kind of set in her, and I think my guess is she probably had a not great experience with it, but she's just like, I just want to be safe, so we're just going to start this at 38 weeks, and
I'm
I
glad
was
you
like, sure.
mentioned your OB because in this country, it's such a big country. You were in California, and
hmm
were you in a big city or small city?
I was in a bigger city. I was just about 45 minutes north of San Diego.
Okay.
But
So,
the hospital that I gave birth at had multiple hospitals within San Diego, so it was large.
and you know why that's important? That's important because, first of all, cesarean section rate in this country is from low 20s to almost 40%.
Yeah,
And it
it's
turns out
it's really really
it's
bad.
really bad, right? But
Yeah,
the lowest is in Alaska, and the
I'm not
highest
surprised.
highest is in Kentucky. You know,
Wow.
that's where that amazing Senate Majority Leader Mitch McConnell. I use my adjectives loosely, and the state of
Throwing
Kentucky
shade
the, the, the
in
state of
five
Kentucky
first 5
has
minutes of the
I
podcast.
know the state of Kentucky has the highest cesarean section rate in the country.
That's
So
crazy.
you are not in some backwood podunk nowhere. You are really in a state of the art facility,
Yeah.
and you have to assume that your doctor was board certified, qualified, and doing the right thing. And
Yeah.
then mild borderline hypertension, you had non stress test, and there was a concern. So you went from her office to labor and delivery
Yeah, in an ambulance.
in an ambulance.
Mhm.
And then you were given all the stuff we talk about, risks and benefits, and why it had to be done, and you had surgery.
Yes.
Uneventful, lovely 6.5 pounder.
Yeah, I wouldn't say uneventful, but she was 6.5 pounds. She actually had to go to the NICU for about 16 hours or so, because she had some problems breathing in the
Hmm.
beginning. So that was a little hard. I think there was a lot of um, trauma in there because, I wasn't planning on having a C-section to begin with. And then I have my baby and my baby's gone in seconds. And, I'm wheeled back to a room where I'm by myself because I wanted my husband to go with our baby to the NICU. And it was hard. It was really hard. I mean, obviously we came through on the other side, but, it wasn't the happiest beginning.
And I think what's hard is that most importantly, it was unplanned.
For
And
sure.
it's a lot.
Yeah.
I mean, we talk
Yeah.
about the birth of your little one being the most amazing event. And with all that expectation, when that does not happen for whatever the reason, I think it's really hard to recover.
Oh, for
So
sure.
at that time, were you already a doula?
Yes. I had been a doula for like a year, like almost 2 years, I think. But I was mainly a postpartum doula at the
Mm-hmm.
time. So my experience with birth um, wasn't as vast as it is now. So I think that put me at a disadvantage for sure with my first.
But you being a postpartum doula, that was helpful. At some point, it became helpful,
Yeah.
not
Yeah.
initially.
Yeah. Yeah,
How
it
would you,
did.
so your labor and delivery experience first 24 hours was a total shit show, right?
Yeah, pretty much.
Pretty
Yeah.
much. Okay.
Yeah. Yeah.
Prior to that, how would you rate your prenatal care overall? Were you
I had a great
happy?
experience with so I had my first OB. Um, I didn't know this, and she had no way of showing it, but she was actually pregnant, and she was about 4 weeks ahead of me.
Hmm.
So when I came in for, I think it was like my 30-week appointment, we were talking about the hospitals and like kind of like just getting in the early stages of planning about, when to call, where to go. And she's like, so I'm actually not going to deliver your baby. And I obviously was shocked and kind of unfortunately had to semi start at, ground zero and look for a new OB. But she gave me a couple of recommendations and I ended
So
up,
until
um,
then, you had no idea. They didn't prepare you.
no, she was
What
like
is
a
that?
really tall woman, and the fact that she was 4 weeks ahead of me, so she was roughly 34 weeks,
Was this a
and I
solo
had no
practice?
idea. What's that?
Was this a solo practice? One
No,
doctor
no, no, lots of OBs. This was
in their
a
practice.
large, yeah,
Yeah. And you had
yeah.
seen her mainly though. Primarily you saw that doctor.
I only saw her
Only
up,
saw
yeah,
her.
up until then.
And she didn't prepare you. Oh yeah, by the way, I'm prego.
Yeah, no, she didn't.
That just was not professional. She should have warned
I
you.
no. And I mean, other than that, she was wonderful and she was very laid back with everything.
Mm-hmm.
Everything was, it's not a problem until it's a problem. Like everything's good. But yeah, that was really stressful for me to kind of form a new relationship with someone, in such a short amount of time from, that point until I had my baby. So it was,
This is kind of like pattern for you, looking for new doctor in third trimester,
oh my God, I swear it's
right?
not me.
So did you find out the other doctor, was it the same practice or totally different practice?
Same practice.
Same practice.
Yeah.
Okay.
Yep.
And you saw
Yeah.
this other
So,
doctor throughout, and yeah.
yeah. Yep.
I mean,
Yeah.
the truth is, it sounds like that practice had 4, 5, 6, 7, 8 doctors.
Yeah.
And you may
Yeah. It was
see
big.
the same person primarily during prenatal care, but in most cases, you won't be delivered by your primary obstetrician. That's just the way it is because of
Yes.
a
Yeah.
call schedule.
That's right.
So beyond first 24 hours, baby came out of the NICU, stayed with you. You stayed in the
Hmm.
hospital for 3, 4 nights, did
Yeah.
well. You recovered, you enjoyed life, and decided to leave the lovely state of California and come
Yep.
to Massachusetts.
We came back here.
Hmm.
So we're from here originally, and then we moved to California, and then we had my daughter, and decided that we wanted to be near family again. So that's why we came back to the East Coast, and we bought a house in southern New Hampshire, and we are never moving again.
Never moving again. Well, don't
No,
speak too soon.
no.
So life went on, and then 2019, surprise, plan
What?
unplanned,
Oh, very, very planned.
very planned.
I'm a planner.
You're a
Yeah.
planner.
Yep.
Plan. You're working as a doula. You planned around your doula work and whatnot,
That's
and
right. Yep.
bam, you got
Yep.
pregnant.
Yep. Yep.
Um, and you started with what practice in New Hampshire? By the way, Amanda, may I say you're not really southern New Hampshire, like a middle of New Hampshire, right?
No, I'm just above Plastow.
So, okay,
Yeah, so I'm like 15 minutes into New Hampshire.
okay,
I'm not
and
that far.
you're not that far. So tell us
No.
about how did you go about finding a new OB or your prenatal care provider?
So I decided to go, originally, I decided to go the midwife route for baby number two. And I had a midwife for my routine exams before I even got pregnant. So I had already established care before baby was around. And so I continued to go there at Exeter. It
Just to
was,
clarify, the midwife was a part of large practice
yeah,
working out of OBGYN practice.
correct.
So
Yeah, there
you
was, it was kind of like a half and half. So I think there was about, at the time, there was like 3 or 4 midwives and I think 5 or 6 OBs. I could be wrong, but it's roughly those numbers.
Just to clarify, your midwife was a certified nurse midwife who would
Yes.
have done your delivery at a birthing center.
Yes,
Okay.
in the
In
hospital.
the
In the
hospital. Okay.
hospital.
In the
Yeah.
hospital. Okay.
Yeah. Yeah. So before I even got pregnant with my second daughter, I knew that I wanted to have that kind of midwifery care where it was a little bit more not looking at what has happened to me before and looking at, my papers and kind of judging what they think that how I should birth in, for the future. And I wanted someone that believed in me enough to know that I could have a VBAC, and because I had a lot of pushback from other people back in California about VBACs. They weren't super friendly about it.
Just in general, VBACs.
Yeah, I mean, they said like, you can try, just make sure you don't do it too close together, and like, like we'll see. But it was like, as a woman who is trying for a VBAC, now I know it's extremely important to have people from the beginning saying, you can do this. You can do this.
So
There's,
let
like
me give you a
you
little
got to believe in yourself.
let me give you a little historical background. So for the most of 20th century, there used to be this dictum: once cesarean, always cesarean.
Oh yeah.
That was the case actually until late 70s. So
Yeah.
but at the time, one thing that is different compared to now is until mid 70s, cesarean section rate was only 5%. Now
Yeah.
it's 1 out of 3.
Yeah.
And then it became okay, well, we'll try vaginal birth after C-section. And then it became kind of trendy. And then late 90s into 2000s, it continued to increase, and then it kind of slowed down again. So right now,
Yeah.
if we look, again, depending on where you are, trial of labor after C-section rate is as low as 25% and as high as 70% nationally.
Hmm.
good news is that, and this, you may know this already, looks like 3 out of 4 women who do try child labor usually end up delivering
Mm-hmm.
vaginally.
Yeah.
So it's interesting. You come from the state of California where people are supposed to be more liberal, more hip, and they're telling
Yeah.
you no. You know, if you had a C-section, one guideline says from the time you delivered to next pregnancy it should be about 18 months.
18 months.
But
Yeah.
that 18 month really is flexible because sometimes if I'm dealing with a woman who's 39, she may not want to wait a year and a half. So it
Right.
varies a little bit, right?
Yeah.
So you come from that environment, you were doula. So
Yeah.
before you got pregnant, you already had a plan that you
Oh,
were
yeah.
going to do VBAC
For sure.
for sure.
Right after I had my first C-section, I was like, I'm never doing this
You're
again.
never doing this again. Okay.
Yeah. So, so yeah, I mean, I think it's really important to know, like, for anyone who's going for a VBAC, the first thing that you need to have is obviously belief in yourself. You have to have the want to do it, and you have to have someone who doesn't say, "Yeah, okay, we can try." Your care provider. You can't have someone say like, "Yeah, okay, we'll give it a shot." You really want to have someone that's like, "Yeah, of course, we're gonna do it. It's gonna happen. We're gonna make it happen."
Now, right there,
Obviously,
I want to say it right there, let's just play that card right there.
yeah.
I think more importantly, for me, I tell patients my job is to support you
Mhm.
and go through that whole process. And hopefully it is to your liking. And here we are, we're talking about with you. I mean, if people are listening, they may already get it that you didn't have, second time was not vaginal, it was another
Nope.
C-section. But
Yep.
my job isn't, I don't want to, yeah, we'll make it happen. What does that mean? I think we'll make it happen so that you try,
Yeah.
but the end result may not be what you thought. That's very important.
I know. Yeah, and you're right, but I think more along the lines of where I'm getting at is someone saying, we're going to try. We're going to give it everything that we
Hmm.
have versus like, yeah, okay, we'll see. If you want to try, that's fine. Like, unless dot 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 dot. So I think you kind of want to get off on the right foot with the care provider who is more VBAC accepting and VBAC friendly and less VBAC tolerant.
So you started in New Hampshire, and
Yes.
then at some point you were not content.
So, because I was a VBAC, even though I had all my care with the midwives, um, I had to have at least one appointment with an OB at some point through the pregnancy to talk about um, risks of C-sections. And I put air quotes because I clearly had a very bad experience with this run-in with this OB, which is why, you came into my life. But, I think that this woman, she comes off as very VBAC friendly, but the appointment was pretty much like, okay, here's what I have to tell you. If you have a vaginal delivery, you could have a uterine rupture. The baby could die. You could die. Like, yes, there are risk factors, and they're very serious and they're very real. And I knew all of those going in. I was very, very prepared for my VBAC. But what I didn't like about her was that she was very much wanting me to kind of go on the safe side of C-sections and telling me that C-sections are safer and that, she's like, I can schedule one right now. If you want me to just put it on the books, I can schedule it right now. And it was kind of like that feeling that I got like, she doesn't believe in me. She doesn't think I can do this. She thinks that this is a waste of time. And it was a very upsetting appointment, and I left in tears, and I'm sure she meant no harm by it and she was just doing her job, but I felt in that moment that I was just kind of another person with some information on a piece of paper, and not a woman that was trying to have a better experience with her birth. And that's why I called you. That's where you came
Well,
in.
that's where I came in. Um, so the one thing I would say about my specialty, this is what I would say. When I talk about finding a pediatrician, I say, you know what, pediatricians, most of them are, I give them grade B, B plus, B minus, B. Like family practitioners, Bs, they're all the spectrum is very narrow. When it
Yeah.
comes to OBGYN, I have to say we are a real shit show. I mean,
Sometimes.
we have A's to F, and there are
Yeah.
the ones who don't have a clue. Many OBGYNs, I think, are just obstetricians. They don't know how to operate.
Yeah.
Cesarean section is not, it's fairly straightforward. It's not a complicated surgery, certainly not compared to complicated GYN surgery. I also know many younger OBGYNs who don't who lack social skills or something because they don't know how to talk to patients.
Not a
Because I
good
mean,
bedside
the
manner.
truth
Yeah.
is I can scare all my patients, right? I mean, yeah, there are always risks, but the reality is with one cesarean section, the risk of rupture is just a smidgen. And
It's very, very small.
and
But that's really what I wanted to um kind of challenge her on is
mhm,
why are you like she let me back up. So she walked in the room, okay, and it was down that I was a doula, and she walks in the room and she says, "So you're a doula who had a C-section?" And I
yeah,
was like, "Yeah."
yeah.
Literally that's what she said. I go, "Yeah, I guess I did." I don't really know how that makes my career any different, and my care any different with clients, but yeah, I did. And she goes, "That's really interesting." And it just like kind of like set off this like, you don't know anything about what I do, and your bedside manner is terrible, because who
Mm,
says that to someone that they just met?
right.
So I just I just had this like worry that if I stayed there and she was in the room when I was trying, for my VBAC, um, that she was going to try and put some scare tactics in me again when I was at my rawest moments,
Mm.
and when my decision making probably wasn't as good as it would be today. And I just pictured that, and I was just like, I don't want that. I don't want her in my birth space. I don't want to have to worry that there's going to be someone who's just waiting for something about my story, that is considered a fail, and wheel me into the OR.
So you continue for a few more visits, and then third trimester, you came down to my office in Woburn
Hmm.
and continued. Overall, I think your prenatal care was unremarkable. Um, no major events, and came due date, you were still prego, and then I think one thing I would say, you were so determined for this process. You had like good few days where you were contracting. Um,
Yeah, I was in
you
labor for
were,
like ever.
yeah, I mean, you were in pain. And
Yeah.
I think because I felt comfortable with our relationship and I knew when it was time for you to come, the long distance relationship was doable. So when you
Hmm.
finally came in, and I think before your due date was over, I talked to patients. What happens when one a person goes beyond the due date? What are the options for someone who desires TOLAC? Options are less than someone who never had a C-section because we don't use any chemical agents. All we
Yeah.
have is maybe the balloon therapy, stripping membrane. But you came in when you were 4 days beyond your due date, and when you finally got admitted, you were 3 centimeters, and
Yeah.
cervix was fairly thinned out, 380 and -3. So you were 3 centimeter dilated. Cervix was almost completely thinned out, and head was -3.
Yep.
And you came in late night and you received some pain medication to get some rest.
Yep. Yeah.
And
I tried that.
yeah, I mean, I think by the time you came in and got admitted, you did really everything you could at home. There wasn't anything left for you to do.
So yeah. So I saw you on a Friday,
Mm-hmm.
which was my due date.
Mm-hmm.
You checked me, and I was only a fingertip dilated,
Mm-hmm.
very, very, very high. Um, and I remember I actually called you after that appointment because I remember you, leaving after the exam. You came back in and you were just like, I don't know. I don't know. And I was like, what do you mean? And you're like, we'll see what happens on the weekend. And I'm like, uh-oh, like, is something bad? Is something wrong? And I'm just like, oh man, I gotta make sure that this baby comes naturally in the weekend because it scared me. I'm just like, well, what happens if like I knew that I could go past my due date. I didn't feel like there was anything going on, but I got a little nervous because yeah, because I'm a VBAC, I don't have a lot of options like you said. So if labor doesn't start naturally, like well, there's one negative check in my corner of
So, just to give you an idea, not too long ago, I had a successful VBAC. Patient was 43, so
that's
over
amazing.
35. She delivered 10 days after due date.
Yeah, it happens.
So the reason why I say that is because my job, and if it at any time if I give negative vibes, I apologize. But my job is to support my patients.
Yeah.
So
Well,
I
that's why
don't
I
know.
called you after.
Yeah, I don't know very many OBs who would let 43-year-old go 10 days beyond her due date and have a
Yeah,
VBAC. And that,
that's
with her,
amazing.
with her, I saw her every other day.
Yeah.
And this is when I tell patients I'm so bad at stripping membrane because I strip the membrane every other day for 10 days. And Jiminy Cricket, I'm just not good at it.
No,
But
if the
finally
body
kept
doesn't
it.
want to go into labor, the body's not going to go into
Exactly. There
labor.
you go. That's the key. So, and then we spoke that night. And then tell us, continue the story. What happened?
Yeah, so we spoke and then so that was a Friday and Saturday came and I put my daughter to bed and we were watching a movie and all of a sudden I started feeling like, ooh, these contractions and um so yeah, they were contractions. My labor had started. That was a Saturday night. Sunday came, Sunday night came, Monday came, still contracting. I was just waiting for some consistency,
Mm-hmm.
um, waiting for a reason to go in. This was in April, so COVID was still a semi new thing. And, there were a lot more worries and concerns about, you know, safety and when should I go in? Should I really wait until the last minute? I was an hour away from the hospital, so there was a lot of worry about like not going in too soon, but not going in too late. And so we finally made the call. I called you, I called my doulas, and we made the decision to come in a Monday night, finally, after
Yeah.
having contractions for days. Yeah, and I had the therapeutic rest.
And like I said, you came in at 3 centimeter and
Mhm.
almost completely thinned out, which is a big
Yeah,
progress compared to the Friday's exam.
yeah.
So,
Yeah, it was really reassuring for me, and I felt like that was the first time that I was like, "Oh, okay, my body's doing this." Like
mm-hmm.
I had never gotten that far at all.
Yeah,
Nothing had ever happened my first time. I was like, "Oh, okay, this is cool.
yeah,
Like nature's taking over. Let's do this." But I was also exhausted.
yeah.
I was contracting every 5 to 15 minutes since Saturday night. So I wasn't sleeping. Um, and I wanted it to be over, but I was still like, you know, going forward. And so I had the therapeutic rest on Monday night, and then I think I saw you Tuesday morning.
Yeah.
That day is a blur, honestly.
Yeah.
I think you probably know more of what happened than I do.
So therapeutic rest, we're talking about morphine, usually 15 milligram with medication, so the like Phenergan, so that you don't have nausea issue. You were
Hmm.
given that. That therapeutic rest is one option, and epidural is the other option these days in terms of any relief.
Hmm.
Whenever you get therapeutic rest, it gives you 2, 3, 4 hours of sleep. We often use it on patients who are early in labor and need rest, either
Hmm.
patients in labor or patients not. In your case, you are kicking in. And I
Yeah.
saw you, your exam was such, and then sometime that morning, you got epidural. When you got the
Yeah.
epidural, I think,
Yeah. I think it was like late morning, early
mhm,
afternoon. I decided, I
I think it was
took a
like 10
shower,
o'clock.
and um, I almost passed out
Yeah,
from the pain and from the fatigue. And I'm like, okay, we're gonna
yeah.
we're gonna get an
So,
epidural now.
so you got an epidural,
Hmm.
and contractions were still happening. There
Yeah.
was a moment where heart rate went down a little bit. You were on your hands and knees.
Yeah.
Late morning. At that time, your exam was about 5 centimeter,
Hmm.
and you had bulging bag of water, meaning you were still intact. Membrane hadn't broken. At
Right.
that time, the significant information is that baby's head was still -3. So if I
Yep.
look at if I look at use that paper tube as a guide,
Hmm.
baby's head was still at one end of the tube. It wasn't halfway through like a zero state. It was still at one end. But you had
Yeah.
progressed 5 centimeter -3, and we started on Pitocin.
Yep. A very, very light
Yeah.
round.
Symmetry. Yeah.
Yep. So yeah, I mean, I think that at that point I felt comfortable having, a couple of these things started, and just kind of helping my body. I didn't want anything to take over what was
Mm-hmm.
happening naturally, but I did know that um, I was tired. My body probably was very
Yeah.
tired, and I was ready to kind of get a little boost. And we ended up, once we had that decel, I'm pretty sure it was because of the epidural,
Mm.
which is pretty common. But after that decel, they turned off the pitocin.
Mm-hmm.
So I only had it, I think, for a couple of hours, and then my body continued, and they never turned it back on, I don't think.
So, and then you got to 8 centimeter
Yeah,
and
I got
minus
really
three
far.
and minus
Yeah,
three.
still -3.
Still minus
She
three.
was she liked it in there.
I know.
She
And I
didn't
broke
want to
the
come
water.
down.
I broke the water, right?
Yeah,
And I broke the water with little guidance because when the head is too high, we want to be careful. But I broke the water, but his head was still -3.
yeah,
And that's where you stayed at.
yeah,
So tell me, I think at somewhere along the line, I know I had to have a discussion with you about where we go. And
yeah.
tell me where your mind was. I mean, as exhausted as you were, here I am, where on one hand, your prenatal care provider, we had worked outside of me being your provider, we are friends, you're the doula, I'm the doctor. And Chun is saying, it's
It's not
whatever
gonna
you
work.
want. And at some point, my job is to give reasonable. I mean, I always say, if she was my wife, what would someone do? The thing that I
Yeah,
didn't like about your exam from the morning, the first morning exam to the early evening, gosh darn head was
I
always
know.
-3. It
I know.
never came down.
I know. I have a lot of, like, looking back on it now, I have a lot of, like, not guilt, but I'm just like, what could I have done? Because clearly she wasn't in a good position. That's why she most likely stayed where she was. That's most likely why I had been in labor for so long, for days, and, really no change as far as where she was. And I always wonder, like, What if I didn't get the epidural? What if I had walked around more? What if I had, waited a couple more hours? And,
This is where I would
I,
say you could not have done anything different
I
because it
know,
was just the way your pelvis was. It wasn't going to
I
fit.
know. And so, and when you told me that, um, I'll be honest with you, after you left, I had probably one of the most primal meltdowns
Hmm.
I've ever had. And it was heartbreaking. It was heartbreaking because this is our last baby. Sorry, I'm going to get a little emotional. This is
This
our
is
last
time to
baby.
cry. You want some Kleenex? I have some Kleenex over here.
No, it's all right. Um, this was our last baby, so this was our final chance to really have that experience that I've always wanted and not have it be, the OR experience that I had with my first. And it was hard accepting it. It was hard accepting that that was going to happen again. And there was the fear um, of what if the same thing happens again when she's born? What if she comes out and she's not breathing and I have to have another NICU baby? Um, and so just all these thoughts were going through my head. And I just was trying to accept the fact that the months and months and months of work that I put in didn't have the payoff that I was hoping for. And it was hard. It's still hard. It's still hard. Obviously, I'm on the other side of it and I'm 95% at peace with it. But in that moment, it was very raw and it was very sad. But I was also tired and I also wanted her to be here. So I also had that side of me where I was just like, just get it over with. Just fine, just do it.
You
You
know,
know?
one thing I say is at some point I have to share what I think is going through my head.
Mhm.
Um, what I see with the younger obstetricians are sometimes they wait too long
Yeah.
for inevitable C-section. And then what happens is risk of infection, postpartum hemorrhage, difficult C-section.
Yeah.
And I feel comfortable saying, you know what, at some point I got to say, as much as I wish it was otherwise, it just isn't going to happen.
Yeah,
Um,
and I think about that too because I know a lot of women unfortunately who have had um really scary things happen to their Tolak experiences. And I've seen the ugly side of it. And I know it's very, very, very rare. And it is. But it still happens. And I know that safety is the first concern. And, I also think, well, what if we did wait? What if we did wait and something bad happened? Like I would never forgive myself if we waited and I said, no, Bill, I'm not going to do this. I'm going to wait. I'm going to keep going. And then something bad happened. I would have been in a really bad place mentally. So, um, it's, it's, I agree with it in a lot of ways. I know that it was the right thing to do at the time, but it's just a hard pill to swallow for sure
sure.
after
So,
all that time. So,
so we tell us. So we finally you consented. We got you
hmm
prepared. We are going back to the OR.
well, before we got rolled back into the OR, I'm gonna share an experience that I had with the anesthesiologist because I think this is really important, and I think you already know where I'm going with this. But I'm going back to having care providers who are in your corner and supporting you from the beginning to the end. I had an anesthesiologist come right before you guys wheeled me into the OR, and I did have some birth preferences. I had kind of like this one section where, in case I did have a C-section, I would ask that you do a few things for me, and one of them was minimize chatter. I really, really wanted to have some type of um, either at the clear drape or the drape dropped or, immediate skin to skin. I had a lot of things that if I didn't get to have my VBAC, how could I make it where this was the closest thing to a vaginal delivery? So, we talked about that, and the anesthesiologist came in and he goes, well, I bet you learned your lesson. Bet you won't be trying for a VBAC again. And it just was a slap in the face. It felt so demeaning, and it was clearly in bad taste and very much at the wrong time. And at the time, sorry?
Unprofessional.
Very unprofessional. And, why would one human being say that to another human being? Like, it's just, why would you say that? Why? There was no need. And at the time my epidural kept failing, so I was in a lot of pain. I was having a lot of contractions, so I just kind of like smiled and was like, okay, yeah, okay. But when we got into the OR, the first thing he did when we walked in there was started talking about some book that he was reading to another nurse. And started talking about, oh, you got to check this book out and da 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 da. And I'm like, you got to be kidding me. We literally just talked about this. So that really obviously rubbed me the wrong way. And I'm just like, please don't let this be an omen to like how the rest of this experience is going to be. And for the most part, it wasn't. For the most part, as far as C-sections go, in today's world, it was a very smooth one. I know I kind of gave you a little bit more work to do with my scar tissue, but I felt like it's hard because I felt very scared. I felt like I wanted it to be over, but I felt very sad. I had all these emotions, and they laid me down. Everything started happening. They pulled the drape up. They tried to tie my hands down. I said I didn't want my hands tied down. And they're like, okay, well, we're just going to put the rope around here. So if you open, if you kind of swing your arms, it'll catch you. Just little stuff like that. It was just like.
Well, now, I'm not defending what happened, but the reason for something around your wrist is people react differently.
With the anesthesia.
With the anesthesia.
Yeah, I know.
And then also the surgery-wise, repeat C-section usually takes about 30 minutes. First-time C-section, maybe 20. When we are in there, it's could be very simple. It could be ugly. There are some hospitals with clear drape. Winchester doesn't have it. And then remember, baby had meconium. So after baby was delivered, had to be seen by a neonatologist. And I think Winchester Hospital, at least or in this area, people are lucky because we have all these hospitals in Boston compared to middle of Louisiana or middle of Kentucky.
Right,
so we have neonatologists, we have neonatal nurse who can assess the newborn. But the skin-to-skin happening at the time of C-section, even when there's no meconium stain, amniotic fluid, whatnot, it's kind of hard to do just because, it's certainly maybe considered, but it would be hard for obstetricians to promise because when we get inside, boy, it's anyone's guess. And the amount of blood we lose, because we want to go kind of timely manner, average blood loss 700-800 or a liter, and that's if you remember the 2-liter Diet Coke, is half of that. It's a good amount of blood loss. So we try to move, and the thing is, not every OBGYN can handle stress well. So when two people are operating with help of a scrub tech, hands are moving, sutures, needles, cut, and many of you probably don't want to see what we're doing because it gets bloody.
I've seen C-section. For me personally, it's amazing and it's awesome, and I love it.
And we have father or baby who sit right next to you. We have had them pass out.
Oh yeah, I know.
So there are
Listen,
so many things that which are happening,
I am not poo-pooing all of those guidelines, and I think that they're there for a reason, and I know they're there for a reason. However, because of where we are, because in 2020 there are videos of anything and everything out there. So
Mm-hmm.
when a woman researches a gentle C-section and
Mm-hmm.
you see, all around the world, these amazing belly births of these
Mm-hmm.
doctors who you know, just have no drape, and this woman is pulling her baby out. When I was planning for my VBAC, I'm like, okay, like if I had a C-section, like I could do that. So you have women who don't really know much about the OR. A lot of women who have either never given birth or never had a C-section don't really know what kind of choreography goes on in the OR. It's a dance in a way. There's a lot of, like you said, there's a lot of moving hands, but to see that it's out there, that it exists. There's people out
And
there who
well,
perform
but
this.
but I don't know in which country that happens. But I have to tell
It's
you,
all over.
as soon as you make an incision on the uterus, bleeding is a faucet that is turned on.
Oh, I
So,
know.
so I can't imagine. And I have let many patients deliver their own babies vaginal, but in
Yeah,
C-section,
that's a different
I don't see
story.
that happening because you know what? I got to repair the uterus. I got to turn the faucet off. So
Yeah,
I'm going to
I know.
see which country those things happen because I bet you anything, it's not in developed countries. It's got to be. I'm gonna check it out because
We're
I
both gonna
can't
check it
fathom.
out.
Yeah, because I can't imagine that happening because one of you deliver the little one, and then as soon as the baby's out, it's all about minimizing morbidity for the mother.
Yeah,
And the blood loss is it's high, especially for someone who's been in labor for a long time. Aside from the incision,
yeah,
uterus gets really boggy, and we're trying to really clamp down the uterus. We got to give different medications. We got to
yeah.
check to see
It's a
if there's
lot.
any extension of incision. So, I'm not saying for OBs we don't get paid well. I mean, it's an argument. But if you see what we get paid for looking after you for 16 to 20 visits and doing this surgery where we lose a liter of blood and all the anxiety that provokes, and then postpartum, you should be shocked at how much you get paid. And I'm not saying money has
Yeah,
to do with anything, but the reality is I see why younger OBGYNs get stressed out. I see why
yeah,
for them, you know, because it takes, I have seen younger OBGYNs who started out with a good intention and they would have one bad case, one malpractice. It changed their outlook completely. They're more
oh
likely
yeah,
to do C-section, more likely to do a repeat C-section versus VBAC. So the bottom line is the job that we OBs have to do, this is not an easy task. I
oh, I
certainly
know
would
it's
not,
not.
you know. So, I mean, opportunity for us to have this conversation. My goal was to really help you unload, and hopefully expressing all this will take you from 95, 96, 97, maybe
Yeah,
99, but never 100%. And I also, just by listening to you, I kind of, I don't, now, one thing that I'm going to think about is my 40-week exam. First of all, I don't do exam every week, but when I said, oh, it's fingertip, I don't know. If I gave the negative vibe, now I'm going to think about it because I shouldn't have given you any negative vibe, you
it
know?
wasn't. I think I don't know. Maybe it wasn't. I got a negative vibe, but I think that you were. I don't know. I don't really know where your head was at, honestly.
I mean, I actually, as you may know, I probably have more thorax than other practice because you
Yeah,
ladies come to me and I think it's my data is 3 out of 4. 3 out of 4 of my patients deliver vaginally. 1 out of 4 don't for whatever the reason. And I
but you know
try to
what?
just support you to the
Yeah,
end.
I want to make sure, like now that I'm 6 months out, and I'm healed physically, I'm healed mostly mentally. I really think that I want to, as a doula, focus on that 1 out of 4,
Mm-hmm.
and make sure that we can make that experience as close to the vaginal experience that they were imagining. Obviously, no birth goes exactly how anyone plans, but I want to make sure, like, I wanted to do this chat with you because I want to get the ball rolling, and at least in our community, like, how can we go forward? How can you and I go forward and make sure that, like, we don't have anesthesiologists that belittle women, for trying for a VBAC and failing. We don't have a situation in the OR where you feel like you're being compromised as a doctor, but we can also have that type of atmosphere where the woman feels like she's a part of her birth. Like, it's not something that I feel like could be done overnight, but I feel like I want to start that conversation. How can we make the C-section not like this, scary, like, hush hush thing, like, oh yeah, oh, you had a C-section, that's terrible. Like, not all C-sections are terrible. There's a lot of women who walk out and they're like, yeah, that was a beautiful experience. I loved my C-section. It was wonderful. Um,
Interestingly enough, the most common reason for C-section in this country is abnormal labor pattern, probably almost 40%.
yeah,
But about 3% of C-section are at maternal request.
yeah,
Um, and I think what you said is very important. C-section is still a birth, and we should not make those women who underwent C-section to feel like they are less than perfect or optimal, or
yeah,
others who had a vaginal delivery. I
yeah,
think it's important to start a conversation like this because this is part of quality control. And I have said more than once, not all doctors are created equal. It's not just OBGYNs, same for anesthesia. And
mm,
I would like for people to understand that medicine is business like everything else. And I know people don't go back to bad restaurants, bad Chinese restaurants or bad hotels, but people tolerate bad doctors. And you
because
have
we
to
think
speak
we
up.
think that I think a lot of women think that there isn't any, like, I can't, like, ask for another doctor. People think, even when you're at Ellen, when you're at labor and delivery, like, people don't know if you have a bad experience with the nurse, you can't, people just endure it. You can ask for another nurse.
Yeah, you
You can
can.
ask whoever you have in your birth room is who you are allowing in your birth room.
That's
And
right.
that should go for the moment that you find out that you're pregnant until you give birth to that baby. It is your birth space. So whoever you feel comfortable is who's going to be there. And whoever is causing you emotional or physical harm, you send them away. You say, I don't want that person. I want another doctor. I want another nurse. And I think that's important too, because that that is not that's not how it's always been for clients of mine, and for myself, even with my first birth, my first baby.
We have long list of women coming on this program to talk about that. Some good,
Yeah,
some bad, some ugly. But it
yeah.
is only way we can improve the quality is saying, you know what, it isn't good enough.
No, yeah, I
And
know.
and personally speaking, experience I have with you and all my patients, it's such an emotional process, right?
Hmm.
You have a relationship for 9 months or longer, and then labor and delivery. That process, the birth of your little one, it is very emotional. It is for me,
Yeah,
and I want to make sure that it goes as good as it gets, as positive as it gets, and when rarely it doesn't happen, it affects us.
yeah,
Um, Not just because it didn't have vaginal, but in 30 years, I can certainly remember few cases which have marked me in certain way. But one thing you said that is correct is we can do better, and we providers should really ask for higher quality for our patients.
yeah. I think
So
it's important to remember that this is an experience for us, and our baby's coming into the world. So I don't really want to hear about someone's, book report on the book that they're reading,
mhm.
just little things like that. And um and celebrating C-sections in a way that, you know, remind women that it's still a birth, like you said. It doesn't make you less of a mother. You're still the same person. You're still their mother, and celebrating that and making sure that we try to equalize it as much as possible. Because yeah, I did for a long time. I struggled with feeling like I wasn't good enough, and um, women who delivered vaginally were better than me and celebrated more than me, and so I think that that's what I want to take from my experience, and I want to improve that for all women, but really Tolac patients, I think really deserve that because you never know how it's going to end, but you should at least have the education and support
And
to
to
get you
finish the
through.
story, your newborn did well,
She
right?
did.
Stayed with you. You went home
Yeah.
at regular, nothing, no uneventful events.
Yeah.
Well, we're going to invite you back to talk about some of your doula experience. But I want
Awesome.
to thank you for giving us your valuable time, and
Thank you.
it was helpful for me, and I hope it was helpful with you.
Absolutely. Yeah.
And I'll see you soon.
All
Thank you.
right. Sounds good. All right. Bye.
So, Amanda's story is not unusual in that there are many cases, I'm sure, with your friends and whatnot, where negative events have happened. Luckily for Amanda, while it was another C-section, newborn did well, Amanda did well, and I hope that conversation like this can only help her. And like I said before, we will have more stories to bring to you, all related to women's health, pregnancy in particular. And if you have a story to tell, please let me know. I would love to have you join me. Until next time, this is Bill Chun.